At the age of 2 year and 3 month, what we have to see when a child is has difficulties with epilepsy, speech delay, hyperactivity is also there, is one of the things that you have to ensure and make sure that as a parent, are you able to understand what makes your child calm down? You have understood that the child has hyperactivity. Agreed, accepted. What is it? Even for 1 second or 5 seconds or 10 seconds, is there anything that makes your child calm down? What am I trying to tell the parent is this, that you have to be a little more observant, mindful, careful, to not just see the negative things, but also find out what are the sparks here. And every child has a spark, by the way. So maybe your child is calmed down when he listens to music. Please, you have to note it down. Then you'll have to remember this, because when the child gets upset or hyperactive, you have to then use music. You have to use music as your strategy to make the child calm down, because that's what you want. I mean, when a child is hyperactive, the opposite of hyperactivity is calming down. Apart from therapies, of course we are talking about therapy, so you have to give therapies. What am I suggesting at the parent level, at the home level only, for this particular child, is to figure out various, maybe 5 things that makes your child calm down. Is she calm down when she looks outside a window towards the traffic? Fine. Don't consider it as negative. Don't, at 2 or 3 months, don't say my child keeps looking at traffic without any purpose. You have to say my child calms down, stays at one place when she's looking at traffic. What that means is you have to figure out all the regulators that the child naturally has, because we will then along with the therapist, then we will do something to enhance those regulators. So from my side, I would say therapy, of course. There is an assessment required, there is a intervention required on the language and communication side, also on the OT side also. Just at the parent level, figure out what makes your child calm down even for some time. Does she calm down when you hug her? Fine, then it means then she responds to tight hug. She responds to your touch. Does she calm down when you listen to music? Does she calm down when she's looking at flowing water? Because at 2 year 3 months, whatever the child is doing can be utilized as a meaningful activity with some idea, with some plan to it.